Mr. Thériault, and next, Mr. Johns online for 6 minutes.
Thank you, Mr. Chair, and it's an honor to be joining you on the unceded lands of Sishat and Hupachesit. Sorry I can't be joining you in person. I was home for the National Day for Truth and Reconciliation, and I couldn't get home. Couldn't get back to Ottawa from home in time. Dr. Pate, in December 2023, you signed on to a letter with more than 130 experts in substance use calling on the federal government to continue to support and scale up safer supply programs. Now, the beginning of the letter reads, quote, as researchers and clinicians across Canada, we are writing out of concern regarding the increased politicization surrounding the response to the drug toxicity overdose crisis that is taking the lives of 21 Canadians every day. We are particularly concerned about the spread of misinformation and the denial of the evidence-based on harm reduction interventions such as prescriber safer supply programs, end quote. Can you please share with this committee your knowledge regarding the outcomes of prescribed of safer supply programs?
Forgive me, are you asking myself or Dr. Gord?
Yeah. I'm asking you, Dr. Pate. Yeah.
Sure. So the entire goal of Safer Supply is a harm reduction framework to try and get you into healthcare, which includes mental health care and the social determinants of health. So there's not one outcome. It depends on what outcome you actually want to look at what Safer Supply is helping. So if you want to look at mortality, for sure, there's lots of evidence that Safer Supply reduces mortality. If you want to look at housing, do people who are in Safer Supply get housed? Yes, they do. As much as we'd like? No, they don't. Do people who get into Safer Supply ever come off their drugs? Some people do. Just like some people quit caffeine, some people quit cigarettes, some people quit alcohol. Do the majority of stop? No, because they don't want to stop. And why don't they want to stop? It's because the trauma and all the other things that they've experienced in their life journey have not been dealt with. So it remains a coping skill for them. The tranquility, the euphoria, the peace that they get from that overrides everything that they're not getting to help them manage the influences that lead them to continue taking that drug. So if you're asking me, which I think you are, is Safer Supply a perfect program? Of course not. Is it a program that actually works? Yes, it does. Does it work all the time for all people in every circumstance? No, but neither does insulin. But that doesn't mean we stop giving you insulin.